In the United States, 1 out of every 25 hospitalized patients are affected by healthcare-associated infection. The most common types of healthcare-associated infections are catheter-associated urinary tract infections, surgical site infections, bloodstream infections, pneumonia, and Clostridium difficile, which short would be C. diff, is more known in the hospital. So after my research, I found out this was a major problem in the United States, and using sterile and clean procedures can reduce these infections up to 70%. 650,000 patients are affected by healthcare-associated infections annually, being a major problem in the United States. So, studies have shown that proper education and training of the healthcare workers on sterile and clean technique can reduce the incidence of infection by up to 70%. So these are some of the guidelines for sterile and clean technique. So the guidelines to properly set up a sterile field is a sterile field must always be opened up first away from the body. Never should be open towards. The field must be kept above the waist, but no higher than the chest. If it's ever above the chest or lower than the waist, it's automatically contaminated. So only the outer 1 inch of the field is considered contaminated. So as long as you touch the outer 1 inch of your field, you're okay. All items must be dropped on the field no higher than 6 inches. Like if you're having to pour sterile water into your field, and also if any water gets on your sterile field, it's automatically considered contaminated. Once the field is prepared, the healthcare professional cannot turn your back to the field. If so, the field will be contaminated automatically. So if somebody walks into your room, if the doctor walks into your room and you turn your back to the sterile field, it's automatically contaminated and has to be totally started over again. So when preparing a field for catheter insertion, the same guidelines are the same, except the patient also has to be sterilized with betadine. So as soon as you touch the patient with your sterile glove, that glove is considered contaminated. So as you're putting in the catheter, you have to make sure that you're holding the patient with the contaminated glove, and anything else you touch as far as the sterile catheter or the sterile field can only be touched with your dominant hand. So this has to be done properly, except the patient is totally sterilized. This has to be done properly because catheter-associated urinary tract infections are one of the main causes of healthcare-associated infections in the hospital setting. Approximately 15 to 25% of patients receive urinary catheters, and 75% of urinary tract infections are caused by urinary catheter insertion. So here is also an example of her setting up a catheter for sterile procedure. So clean technique is also a major part in preventing healthcare-associated infections. An example of clean technique would be washing your hands before entering the room or leaving the room. It's a major role in using like Germ-X in hospitals. So you can use an alcohol-based product before entering the room and leaving the room. The main reason for clean technique, you have to wash your hands if they're visibly soaked. Because also this can be overlooked easily since it's a standard procedure and is done many times a day in the hospital setting. By just not washing your hands after leaving a patient's room, bacteria can spread from room to room and infect a whole hospital floor. So, it is also important that the surgical equipment are properly sterilized in an operating room. The main way surgical instruments are sterilized is going through steam sterilization. It is also vital to maintain strict sterile technique in the operating room, making sure that you're wearing sterile gloves, you're wearing your mask and sterile gown. This here is also an example of what it would look like in the operating room and your surgical equipment. This also, the surgical equipment cannot be touched. This whole table would be totally sterile. So the sterile equipment cannot be touched, and they cannot be touched unless they're sterile gloves or completely scrubbed in. If the instruments are contaminated before the procedure, bacteria can be put directly into the patient, which would be one of the main for like bloodstream infections. So, in the medical field, it is vital to maintain clean and sterile technique to protect every patient the healthcare provider comes in contact with. So, the reduction of healthcare-associated infections is maintained by the strict use of clean and sterile technique. So, as a future healthcare professional, I would strive to maintain the guidelines I was taught on clean and sterile procedure so I can protect all my patients that I come in contact with.